So from time to time, patients under our care are undergoing surgery. What do we do? I've had this happen to me on numerous occasions. And based on my experience from these many requests, I suggest a simple approach. Paramount is the aim to minimize any risk from herbal interactions. And then the secondary but equally important goal is to ensure a healthy recovery from the surgery. So first, avoid any potential for interactions and adverse effects. It's good to be cautious. So generally, I recommend patients stop for about 1 week prior to their surgery. There's one exception, I'll give that to you later. Now, when you look at papers in the literature, especially written by anaesthetists, they say 2 weeks. But I think that's incredibly excessive because they don't necessarily do that for prescribed drugs. So why are herbs so active that it has to be 2 weeks? They'll wash it out of the system in 1 week, no problem at all. And this precaution, even this 1 week precaution, is not because there's any risk of evidence of harm. It's just conservative because there are potential unknowns. And I would add that there is no definitive proof of harm from taking herbs right up to the day of surgery. And this is despite the fact that surveys have found that herbs used by patients undergoing surgery is widespread, and not to mention dietary use of herbs. And there are two important examples of that in this bullet point, because one of the main issues expressed in medical journals is that some herbs increase the tendency to bleed. And I believe that concerns about garlic and ginger do have a rational basis in this regard. And there are recorded cases of excessive bleeding during surgery due to high intake of these herbs, but not from supplements, not as prescribed by a therapist, just via the diet. Now, the next goal is to minimize the effects of general anesthesia. The longer the time under general anesthesia, I've observed, the more likely patients will experience ill effects. And they can feel the ill effects for weeks and even months after the surgery. So the herb I employ here is a concentrated extract, a high silymarin extract of the St. Mary's or milk thistle. For example, I use a 200 milligram extract tablet. And my clinical experience is this is hugely beneficial. It's the one exception that you can take it right up to the day before surgery. Obviously, nothing on the day of surgery, nothing herbal at all on the day of surgery, but you can take the St. Mary's or milk thistle right up to the day of surgery, and I suggest it started about 3 weeks prior. And then in general, for at least 4 weeks after. But that time period after, and indeed the dose that you use, is influenced by the time of the general anesthesia. So for surgery up to 2 hours, I do 3 tablets a day for 3 weeks prior, not the day of surgery, and then continued as soon as possible for another 4 weeks after surgery at that dose. If the surgery is going to take 2 to 4 hours, we up the dose to 4 tablets a day, and it's still taken the 3 weeks prior, but then it's continued longer after surgery for 6 weeks. And if the surgery is lengthy, it's more than 4 hours, then as the prep, I'll give the 4 to 6 tablets a day, 3 weeks prior, and then we'll probably continue for at least 2 to 3 months post-surgery, not necessarily at 6 if I've used that prior, but certainly at least 4 tablets a day. Now, the third objective is to promote healing, and part of that, is, of course, is to reduce the risk of the surgical wound being infected. So immune support, especially in the first 2 weeks after surgery, is a key aspect. And it not only will reduce the risk of infection, it will improve healing. Now, you can choose from the range of wonderful immune herbs we have, but I'm sure you're going to guess what herb I'm going to be recommending. And there is a rational basis for this because cells belonging to the innate immunity are intricately involved in the early phases of the healing response, and major surgery is known to suppress natural killer cell activity. And for these two reasons, echinacea root, to me, is the key herb to use post-surgically in terms of immune effects. It has an affinity for the innate immune system, in my view, and we have research that shows it's especially good at boosting natural killer cell activity. And then we want to also use herbs that promote revascularization and connective tissue production. And there are three key herbs for this: the gotu kola, grapeseed, and ginkgo, but we combine them with my microcirculation dietary protocol. So in terms of timing, generally I'll recommend the echinaceas taken for about the first 2 to 3 weeks after surgery. And the gotu kola, grapeseed, and ginkgo are started as well immediately after surgery, but they can be continued for 4 to 6 weeks or even months, depending on the healing. And I've had such good feedback about this approach. Patients say to me, my surgeon is amazed at how quickly I'm healing, or they say, oh, the last time I had surgery, I felt so unwell for weeks and weeks after the surgery because of the general anesthesia, and now because of the St. Mary's thistle and the Silymarin extract, I didn't get any of that. So just to finish off, here's my 5-point phytonutrient dietary plan for boosting the microcirculation, and I'm sure many of you are familiar with this. So again, that's commenced after surgery. And we know that surgery does damage the microcirculation, especially in elderly people. It's the general anesthesia that does it, as well as the incisions. And so I think it's very important to implement this dietary approach post-surgery. Maybe until the wound is fully healed, you could hold back a little bit on the garlic because of its blood thinning properties. But dietary nitrate, especially the beetroot, the cocoa, the berries, and the herbs and spices, but especially the green tea, turmeric, maybe hold back on the ginger as well for a couple of weeks. So thank you. This has been tried and tested by me in my clinical practice over many decades now, and I hope you find